Thank you so much again for joining us. I am thrilled and excited to introduce you to today's expert. She has joined us before, so welcome back, Anna. We're glad to have you.
Thank you, Sarah.
I am excited to introduce you to Dr. Anna Ojeda. She joined the Jackson Health System Department of Psychology back in September of 2023, and she comes with truly a wealth of knowledge and experience, both in outpatient and inpatient child and adolescent psychiatric settings. So after receiving her bachelor's and her master's at the U, Dr. Ojeda, I do, Dr. Ojeda graduated from Regent University in 2008 with her doctorate in clinical psychology. And then she completed her clinical internship at Jackson Memorial Hospital, University of Miami Miller School of Medicine, and her postdoctoral fellowship at Nicholas Children's Hospital. She has also become board certified in clinical psychology by the American Board of Professional Psychology back in 2018. And she has had a strong role in the community. I love this. We were talking about this before, but she is the co-founder and executive director, as well as supervising psychologist for the Urban Promise Miami, which is a program pioneered off of a program in Camden, New Jersey, which is focused on empowering neighborhood youth to reach their potential despite all the odds that may be against them. And what's cool, back in 2020, Urban Promise merged with Hope of Miami. You might be familiar with that organization, which is a similar nonprofit. And Dr. Ojeda continues to volunteer there. I don't know when you have time to volunteer, because I feel like you
Not as much
probably
after the baby. Not as
That's
much after the
right.
baby.
We should add that the most important thing about her resume is that she's a mama. So all of this that we're going to be talking about is not just a head knowledge for you, but is heart workings that you are living out with your child as well. And so
Yes,
you
yes.
can imagine all the feelings that not only kids have, but moms have as we step into back to school season. Um, you know, some kids are wrestling with a lot of things going back. Some kids are going to school for the first time. So not only the kids have anxiety, but sometimes the moms. So let's start off talking, Anna, share with us about what is anxiety and how is that different from just jitters or worry or kind of nervousness?
Hmm. So first, I'd like to say thank you, Sarah, for that introduction and just welcome all of you. And thank you so much for having me and for listening to what I have to share. And it's open to questions and clarifying questions. And we can keep it an open discussion as well.
Let's do it. I love
So
that.
anxiety is such a common issue, right? We all struggle with anxiety at some level. This is a tough life, tough world that we live in, and school can be really, really stressful for kids. Actually, we here in the inpatient unit at Jackson during the summer, our numbers are pretty low. Our kids are okay. They're not struggling as much. When the school starts, our inpatient unit gets a little more busy, unfortunately. Yeah, so school is stressful for kids, and it's also a wonderful place for kids, and it's a place where kids get to just go and interact with their friends and have fun. And we, of course, we want it as parents, we want it to be the latter, right? We want it to be fun and not stressful. However, we cannot avoid that it can be stressful for kids for many reasons. So anxiety in general is a feeling of fear, uneasiness, lots of worries. And like I said earlier, it's true for everybody and it's common. Okay, we're all going to have anxiety at some level. So I like to talk about anxiety on a continuum where we have some anxiety and we have clinical anxiety on the other side of the continuum, right? But everybody kind of falls somewhere on that spectrum. Sometimes anxiety can cause physical symptoms. So it could cause restlessness, tension, maybe rapid heartbeat for some people. For little kids, we'll talk more about this as we proceed, but can have a lot of somatic complaints or complaints about their belly or their head, things like that. So anxiety is also a very normal reaction to stress. Okay, so if you're very stressed out because you have a big project due or your child has a big project coming, or even starting school, which is what we're talking about today, right? Starting school can be that stressor that can cause some normal baseline anxiety. However, it can become a little more of a problem when it is now interfering with your daily life, interfering with your child's life, and maybe even preventing them from wanting to go to school, period, right? So they can develop a school phobia or something of that nature, or if they start having panic attacks, which is all of those physical symptoms that I talked about, but at a much higher scale. So
Yeah.
that's when we start to notice and maybe need more professional attention.
Yeah. That's great. I love what you said about the continuum. I've never heard it put that way because I think I've always thought we just need to avoid anxiety at all costs. Like,
No,
don't have any, but no, you're right.
no,
Like, it's going to ebb and flow, and we need to
yep,
just make sure things are staying healthy. And I will, one
yep.
thing that just came to mind, I haven't seen the movie yet, but I know that Inside Out 2
A
is
great
getting
movie for
right now.
anxiety.
Okay.
Great,
Okay. I
great.
knew that that was like a feature in it. And so I wondered, I was like, I wonder if
Yeah.
she's seen that.
Yeah, yeah,
Um,
yeah. The first, so we use it here actually with the kids on in the hospital. The first one is more like just general feelings
uh-huh.
about emotions, and then this second one is mostly about dealing with anxiety, and it's great. Highly recommended. Highly
Awesome.
recommended.
Great. Well, there's a little tip. Everybody should go to the movies
Yeah.
today. Take your kid to the movies. A good conversation starter, right?
Yes, yes, yes.
Awesome. Okay. Talk to us about what are like the common, maybe the more typical fears that children may deal with.
Yeah, so here I want to talk about the differences between common things that little kids are fearful of, and then common things that maybe teenagers are more
Okay.
afraid of, right? So we can separate. And then I
Yeah.
see that there's a lot of kids in the audience, or parents of kids in the audience, that are kind of in the middle, like that
Yeah.
middle school. And that's a really tough age because they still have a little bit of like young child in them, and then they're starting to become teenagers in their mind, right?
Right.
And so this is a tough one. So I feel for those parents in that age range, because you're not one or the other. It's very hard.
Yeah.
um, so the younger children are more prone to be anxious about external things, right? Like animals or insects or the dark and monsters under my bed or
Mhm.
something bad happening to my mom and dad, right? When they start to realize, especially around the ages of like 9 and 10, I saw some kids
Okay.
there, they start to understand death
Mm.
better. And so they start to understand that death is irreversible, right? So when
Yeah.
someone dies, they don't come back, and they get that more or less around that age. So
Okay.
you can see more anxieties around that, which is very normal, very, very normal, nothing
9 and
pathological.
10. I didn't realize that
Yeah,
was the age. Okay.
yeah. Earlier, however, they can have fears about separation. And if in your family you have had loss, they may not yet fully understand death, but they can still be afraid, oh, that may happen to my mom or my dad, and I may never see them again. Or I may not see them for a very long time. And that can be very scary and stressful for them as well.
Gotcha.
As they start getting a little older, the fears become a little more internal, right? So
Okay.
it's less about other people, and now it becomes more about them, right? So they're more likely to be worried about themselves, their performance in school. So in returning to school, there could be a lot of fears about the pressure that they may feel succeeding in school, their parents being proud of them, how they're performing in sports, and especially how are they perceived by other kids?
Yeah.
How are they perceived by their buddies, right? That is part of your identity development as a teenager. It's who
Mhm.
am I, and then who do people think I am, and how do I get to somewhere in the middle there?
Right. Right.
Um,
Yeah, that's interesting. So those of you that are listening, you're probably identifying with some of this. Oh, my kid kind of falls in this range or that range. So that's
right.
super helpful. We talked about fears and jitters, but then we talked about anxiety and that continuum. How common is anxiety in children?
Unfortunately, very common.
Mhm.
So it affects 1 in 8 children.
Oh,
Okay, so
wow.
that's a very high number.
Mhm.
The National Institute of Mental Health has, they update their stats on this all the time, and what they're seeing is that the prevalence is obviously going to be higher in ages 13 to 18, right? So teenage years. And the
Right.
reason for that, even though anxiety is very common for young children, many young children can overcome it, right? So
Mhm.
a lot of the fears that I just talked about, monsters under my bed, the dark, losing my parent, all of those they can start to let go of slowly as they develop. And then for some kids, they're not going to be able to really let them go,
Mm.
or they mask it really well for a very long time, and you don't see the impact of the anxiety until they're teenagers, into the adolescent time. So I think that's why prevalence is a little higher there.
Yeah.
So between ages of 13 and 18, we're seeing 25%
Wow.
of children having an anxiety, an actual disorder, right? So a
Wow.
diagnosable clinical
Like
disorder.
over here on the spectrum.
Exactly. Over here on the more serious side. Obviously, anxiety leads to a lot of different things with adolescents, which we can talk about a little later, and can also it can also lead to depression,
Mm.
because anxiety can be so impacting. It can
Mm.
interfere in your life so much, that it can become a depression at some point.
Wow. Yeah.
Um, Something to note that I think is really important: if your child is shy or withdrawn naturally, like that's their temperament, that's their personality, nothing wrong with that. Believe it or not, here I am talking on a
Yeah.
webinar with how many
I
people?
love it.
A lot of people.
Yeah.
And I was a very shy little girl. And
Yeah.
as a result, I have struggled myself with lots of anxiety throughout, on and off, throughout my life, right? So
Mm.
children that are shy and withdrawn have a more likelihood to develop anxiety, clinical anxiety. So we
Mm.
have to be more conscientious of those children. And we'll talk a little more about what parents can do. And so
Yeah.
you may want to be more aware and do those strategies more with those children.
Oh, that's good. And there's so much here. As you're talking, I'm like, oh, I want to go down that rabbit trail and
I
that
know,
one. So we're going to go down
I
some
know.
of them because I want to dig in deeper on some of this. So you talked about that 1 in 8 for the
Mhm.
young kids and 25% staggering
Yeah.
for teenagers.
Mhm.
Can you talk to us like, are there certain, risk factors or things that make a child more susceptible? I know you said that obviously the shy personality, but is there anything else that might be common causes or triggers,
Mhm.
children and
Yeah,
teens?
so on this side of the spectrum, the more serious, more clinical, let's just say clinical versus non-clinical, just to separate the two, right? So normal, I hate the word normal, but let's say baseline, typical, let's say typical anxiety versus clinical anxiety. So
Okay.
on the clinical side, some of the things that can cause it are, unfortunately, traumatic events as a young child. I think that kids have a really, really hard time kind of conceptualizing, synthesizing, they internalize so much of what happens in their world. And so
Yeah.
when something kind of shattering happens in their world, they are more likely to develop an anxiety disorder
Mm.
in the
Mm.
future, or in their short-term future, like when they start transitioning to adolescence. And you could start seeing some anxiety features early on, right after that trauma as well.
Mm.
Sometimes you don't. Sometimes a parent will tell me, this happened in our family and my child seems perfectly fine.
Wow.
And I like that. That could indicate that that child is incredibly resilient. In other words, they naturally just know how to cope with difficult things.
Mm-hmm.
Or it could mean that they're really masking the anxiety, so they're keeping it inside. And so it's really important early on, if something has happened in the family that you think could have affected your child, that you seek some professional help early to prevent maybe some worsening symptoms.
Yeah. And when you say event, you won't get too into it because I can go too off track. But when you talk about, significant events of a childhood, I mean, are you talking things like, I assume, divorce, abuse? Like, what are some other things that maybe we don't think about that could actually create trauma that might produce that anxiety that
Sure. I mean, it could be those big things like divorce. Divorce is definitely something that's going to cause, and not even divorce, right? Let's just say conflict at home,
yeah.
right? So a lot of times I've told some families that are hesitant about pursuing divorce because it could affect their children. I always assess how much conflict is happening in the home.
Mm.
And many times they'll say, well, it's really bad. And I said, well, the conflict could be even more detrimental.
Mm.
The ongoing conflict can be
Right.
more detrimental to a child than even divorce. Because with divorce, there's difficulty, but there's also some level of relief that I no longer have to be in the middle of this conflict at home.
Right.
So
Right.
we have to take that into consideration. But a death of a loved one, that's a really, even if it's a far removed loved one, but they're aware of it, you know, it doesn't have to be
The
a very
loss.
close family member. Kids are very sensitive. They're like sponges. They're totally taking things in. If there's a big storm, you know, a hurricane, if there's an accident, you know, even a slight accident that didn't, you know, turn out to be anything major, it depends on the child. You really have to kind of go back to that child and talk to them about it and say, hey, this happened. How are you feeling about it? Right. And we'll talk more about strategies later.
No, that's good. That's great. Being a student of our children too, to know like, okay, this one's really sensitive to these sort of things. That's great.
Yeah,
Talk to us about just the signs that parents might see in children that are feeling anxious or otherwise just struggling, you know? What should we
sure.
look for as we're trying to be a student of our children?
Yeah, if I can just add to the latter question real quick before I forget.
Yeah, please.
Also keep in mind if there's a family history of anxiety, be very mindful of that as well. Okay, so family history of anxiety can lead to your child having a predisposition to being more anxious. Okay, and that does not mean for all the parents here, please, because I'm a parent too, and oh my God, is mom guilt real? It's a
Oh my God.
real thing. So for all the parents here, it doesn't mean it's your fault.
Yeah.
It doesn't mean that if you have an anxiety disorder or someone in your family does it, it's your fault that your child has anxiety. That's not what that means. It just
Mhm.
means be more aware. That's
Yeah.
all.
Yeah. We
So
can
to
create our own anxiety with all the mom guilt, you know?
exactly.
We should
So
have an
just,
episode on that. I'm just going to put a plug in there for
I
talking
think so
about
too.
mom
That's
guilt.
a
I
really
think you're
good
onto
one.
something.
But for that one, I'm going to be a participant, not the
Yeah, there you
expert.
go.
Okay. So you were saying what are some of the signs that
Yeah, the signs your
parents.
parents should look for.
Sure. So for children, we're going to see a lot of somatic complaints with anxiety, right? We're going to see a lot of tummy aches and unexplained tummy aches, unexplained headaches. Um, and obviously, if they ate something, you know, if they ate a lot, then that's not an unexplained, you know, tummy ache. But if they're just randomly having these tummy aches or headaches, we want to always check it out with a medical professional. And if they find nothing, you can assume that it could be some anxiety happening for younger children. That's usually the first go-to. Um, if a child becomes, you know, when they're small, you can also see more hyperactivity, difficulty concentrating. It's very challenging for parents and for professionals, including psychologists, to differentiate between anxiety and attention deficit disorder in young
Mm-hmm.
children because it looks the same
Wow,
on
yeah.
the surface, right? So kids sometimes are very hyper and they're not hyper because there's an attentional structural issue in the brain, like with ADHD, but there's more of a mood component of anxiety, which
Mm.
makes them feel very jittery and very active. So
Okay.
that's mostly the picture you see in children.
What would take the discerning in the difference? Just over time, seeing how that plays out, or
So with ADHD, you typically want to see that the behavior is true in every setting of that child's life. So you want to
okay.
see that the attention and the hyperactivity is happening at home and at school and other environments that they're, you know, part of. And with anxiety, it could be in one particular environment.
Okay.
So, for
Makes
example, if there's something going on at home that's creating anxiety, sometimes kids are very anxious at school and they don't demonstrate it at school. They come home and they lash out at home.
act out.
They
Yeah.
let it out at home, right? Or if there's a lot of conflict at home, the teacher may be seeing the anxiety at school, but maybe at
Mhm.
home they're really trying to not create more conflict.
Yeah.
So anxiety you don't see necessarily. You could see it in every setting, but you don't have to see it in every setting.
That's good. Thank you
Mhm,
for answering
mhm.
that. Along those lines, we had a question from our audience here.
Sure.
Well, it's like a scenario. So, okay, this attendee says their son is stressed, angry, in a bad mood when at school. He's a different kid in the summer, effective, happy, bubbly. Is that common, or is that a red flag that something is wrong in his school environment?
Um, Right. So I think there is some level of indication that something's going on in school, because if that wasn't the case, you would see the behavior continue through the summer.
Mm-hmm.
Um, and it depends the severity of the behaviors, right? Like we're talking angry, where on the continuum of anger, right?
Right.
Because some of it is normal stress from school. School can be stressful, just like work is stressful for adults, right? You have
Hmm.
homework, you have things to do. So I think could be that it depending on the severity of the behavior, if it's
Hmm.
not that severe at school, the anger, the irritability, then I'd say maybe it could be just normal stress. If the behavior is pretty severe, it could be that there is something more going on at school or internally for that child at school.
Okay, that's helpful.
Mhm.
Here's another audience question, and I will say, you're free to say, that might be something we need to talk about in the office, or because
Sure, of
we'll let you
course.
determine that. Here's the question. So the teacher mentions concerns for. I'm wondering. There's two questions. I think they go together. Teacher mentions concerns for selective mutism in a 4-year-old, and you'll have to tell us what that means.
Mhm.
He is shy generally and no speech deficits, bilingual. What's the best examination method to assess whether anxiety is the underlying factor versus
Mhm.
personality? And would resources be covered by insurance? That would be something, can people make an appointment to come with you?
Yes, 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 yes. It is covered by insurance. You can
Awesome.
always reach out to a psychologist, either here through Jackson or anywhere in your communities. And they will let you know if the services are covered by your insurance, but most psychological evaluations by a psychologist are covered by insurance,
Awesome.
most insurances.
Awesome.
I do recommend if there's selective mutism that it is evaluated with a psychologist. The
Mhm.
reason for that is yes, anxiety can lead to selective mutism. However, that is a pretty severe manifestation of anxiety,
Mhm.
um, and can be a manifestation of trauma also.
Okay.
Okay. Usually, what that tells you is that a child feels incredibly overwhelmed in their environment or internally, right? So it's either external or internal, and this is their protective. This is how they protect themselves. It's it is a very it's not a very common thing, but it is a very important manifestation of anxiety and or trauma and should be evaluated by a psychologist.
Okay, great. I'm going to give you one more scenario, and then we're going to circle back to. I want to discuss more of the risk factors. We talked
Of
about
course.
clinical, and then I want to talk more about typical. But one more scenario. So this listener, their son has recently been diagnosed with PTSD and adjustment disorder. He's recently gone through a lot of changes, with his dad and the mom over the last 3 years of divorce, back and forth changes in living. He's been having a lot of trouble with school. He had great grades, but in the last bit, it was really hard. He went from A's and B's to D's and F's. He was suspended more than 5 times. He's 12 going to the 7th grade. And his very early diagnosis was DMDD,
Mhm.
ADHD, and ODD. And she said the behavior is in all settings, homeschool, with dad,
Mhm.
with mom. Um, so I guess, yeah, maybe she's looking for some direction,
Yeah.
encouragement there.
Yeah, yeah. So apparently here we have a diagnosis already. DMDD is a challenging diagnosis, right? Because here we're looking at more than just anxiety, right? We're looking at a mood disorder
Mm,
that can be quite severe in terms of the way that the behaviors are being manifested. And so this is a child that should definitely be in treatment both medically with a psychiatrist and with a psychologist and in continuous treatment. We don't want these issues to escalate, right? By the way, it's very common to have ADHD with ODD. They usually come together. I call them cousins. They like to travel together or siblings.
mm.
Um, and so and when you add on top of that, you add the DMDD, then they're looking that those issues that he had maybe when he was younger are now progressing to something a little more complex. So
Mm.
definitely find the correct treatment, both psychiatrically and psychologically.
Great, great. Thank you for that. All right, let's circle back. We talked about the risk factors and we said the clinical kind of degree of anxiety, but what about just the typical risk factors maybe that we're looking for?
Yeah, so like returning to school, coming back to school is going to have your normal, typical anxiety jitters, right? Like
Mhm.
A lot of worries, right? So like, I wonder what my teacher's going to be like. I wonder what my classroom's going to be like. Maybe a
Where's
child
my
that's constant.
locker?
Oh
Yeah.
yeah, my locker. Am I gonna have a
Belonging.
locker? Am I gonna get lost in school for kids that go to really big schools? Those are real things. I don't
Yeah.
know if you guys remember your first days at school, first day
It's a
back to school,
lot.
but those are scary.
Yeah. Is my outfit okay? I mean, if you didn't have uniforms, I was like all the
It's
things.
hard,
Yeah.
exactly. So those are very normal things. They could feel maybe like some like physiological tension and maybe heart rate, like they're feeling their heart going a little faster when they think about going back to school. And you're gonna get maybe a lot of questions if it's a very verbal child, because that's a lot of what's going on in their mind, a lot of worries.
Yeah.
Um, so again, we want to be mindful of all of those things and just talk to them a lot. I have some other strategies later. I guess I can just throw them in right
Yeah.
now,
That's great.
Sarah. So I love this one. It's the 3-3-3 rule.
Okay.
And that is just a simple strategy to help with these typical anxiety jitters, right? Especially about returning back to school. And that's help them learn how to do the 3-3 rule, right? Which is
Okay.
whenever you feel really nervous about school, or especially when you're there, I want you to look at 3 things you can see in the room,
Mm-hmm.
3 things you can hear, right?
Yep.
And with little kids, you want to identify, you want to say like sounds
Yeah.
they can hear, and maybe move 3 different parts of your body
That's
just
good.
to kind of release that tension.
That's
Okay, so
great.
helping children learn to move and stretch is a
That's
really
great.
great technique to kind of reduce the jittery feelings.
Yeah.
Okay,
That's awesome.
with teenagers, we do the 5 rule, which is 5 things you see,
Awesome.
4 things you hear, but that's a little too complicated for little
A
ones.
little.
So I like the 3-3-3, which
Yeah.
is a mindfulness activity, but it really helps them just to calm down. I also recommend having a calming corner at
Yep.
home. A lot of schools have calming corners now. I'm
That's
so happy
awesome.
about
That
that.
really is, yeah, a movement I feel like is happening. That's great.
Yeah, there's movement in mental health in schools. It's great. So if they have that at school, fantastic. Maybe ask the teacher, do you guys have calming corners at school? They call them different things. Some
Yeah.
call it the quiet corner or the quiet space. Ask them about it. Ask your teacher about it. Um, and then also have one at home if you can, so
Yeah.
you can
Definitely.
pick a little corner in your home, put a blanket. Weighted blankets are really great. Comfy pillows, maybe have a feeling chart on the
Mm-hmm.
wall by that calming corner, maybe some fidget toys.
Yeah.
Scent, like really calming scents is really helpful too. And then encourage them to kind of go to their corner when they're feeling those jitters.
It's
Okay.
great.
And if your child has a diagnosable anxiety disorder, it's even more important to have this calming
Yeah.
corner, right?
It's so great to hear because we do these things as adults. Sometimes we're not
Yeah,
thinking, I want to cozy up in my chair with a coffee and a blanket. It is
exactly.
helping our kids who don't
Yes,
have that frontal lobe development yet to think
exactly.
to do that. That's awesome. I love
Yeah,
hearing.
and it's very containing, right? Like they're feeling so overwhelmed with these worries and these jitters in their body, and so you're basically helping them find a corner, a space where they can just feel safe.
That's great. That's
So those
great.
are just 2 very, very easy strategies to manage these normal jitters.
Love that. 333 and the calming corner space in your home.
Hmm.
What about should we be having, some kids are just loving life for summer. They're not thinking about school. And there's some they're nervous, they're already thinking about it. But
Yeah.
should we be having these conversations now, even for the ones who are acting, indifferent, like, hey, how are you feeling about school starting? Or to
Hmm.
kind of gauge where they are?
100%, right? The more conversation, the better. Never, fall short. Don't be cheap with conversation, is how I like to tell parents. Don't be cheap with conversation.
Yeah.
Always open the door for conversation. Always say, maybe use some of your examples. When I was in school, I sometimes felt very nervous before school starting. How about you? And they may say, oh no, I'm so excited. Or they may say, yeah, sometimes I think about it, or they may be quiet. And
Mm-hmm.
that gives you an indication as to where they are. And you guys are the expert on your children.
That's right.
right? So you also know your children super well. So follow your gut. If you're feeling like they're getting a little more nervous, if their behavior is a little more irritable or different, and they keep maybe bringing up school, kind of gives you some indication that there's some worry there.
Something
And
there.
even if, like Sierra said, if there's no concern, they're acting super cool, it's still helpful to talk about it. It's still helpful to open the door so that they know you're available to talk if anything changes. And
Yeah.
maybe even providing the calming corner anyway, or
Yeah.
providing the 3-3-3 rule anyway, right? Just to give them tools, always tools in their toolbox.
That's great. Oh, I love it. Okay, let's talk about if two-sided question. If a child is feeling distressed, how can we help them manage anxiety? And then also, what are things we should not do?
Yeah.
What should we not do if
Yeah,
they're
yeah, yeah.
feeling distressed?
So I think we've talked about what to do, right? So
Mhm.
if they're feeling distressed, we want to talk to them, we want to comfort them. We want to, very important, we want to validate their
Yeah,
experience, right? We want
yeah,
to let them know this is very normal. I totally understand, right? Whatever it takes for them to understand that you hear them, that you're there for them.
yeah,
What you don't want to do is you definitely do not want to invalidate the experience, right?
yeah.
Like, oh, you'll be fine. It's
Yeah.
fine. Everybody goes to school. Get over it. Or
Stop
you definitely
crying. It's not a big deal.
don't, it's not a big deal. What are you crying about, right? Um, I think that's going to exacerbate the anxiety tremendously, right?
Yeah,
If they hear that you're there, that you get it, that you understand it, I think it's going to really be
yeah,
much more supportive. So don't dismiss the concern and
yeah,
don't invalidate the concern.
yeah. I think it can feel counterproductive, so like counterintuitive even sometimes to be
Mhm.
like lean into that, sometimes you
Mhm.
want to be like, no, it's okay, like be tough, you got
Of
this.
course, of
But
course.
and it's so revealing of how it was dealt with us as well, because it's kind of our natural bent to do what was done to us. So it's
Exactly.
just good to I'm glad that you shared that. That's
We
helpful.
always want to improve parenting, right? Even
Yeah,
my
that's
mom
right.
tells me, even my mother tells me that you're going to be a better parent. I hope you're a better parent than I was, right?
I
And
know.
I'm going to want my son to be a better parent than I am. So,
Right.
right, we always want, and we have more education than our parents did.
That's
We
right. Maybe
know
about
more.
100 generations. We're gonna really have it down.
Exactly. We know so much more. So we have the responsibility to act on the knowledge that we have.
That's right. That's right. Okay, what about we've already kind of addressed this, but if you're an anxious parent, how does that reflect on towards your child, I guess? Can it cause anxiety for your child?
Sure. Yeah. I mean, so again, we're going back to this mom guilt thing, right? We have to be very careful. We don't want to assume responsibility for your child's anxiety.
Mhm.
However, of course, we know that growing up in a family where people are fearful and anxious can teach a child to be afraid also,
Mhm.
right? So I'm sure you know people that their parents were really scared of swimming, and so that they never taught them how to swim, and now they're fearful of the water because their parents were fearful of the water. So those are just some examples, right? So yes, anxiety and sorry, not anxiety, but fear can be taught. Okay.
Yeah.
Um, Whether that fear develops into anxiety and persists and becomes a problem, that's a whole nother ball game, because that
Yeah.
is more complicated. That could be because there's some genetic predisposition to anxiety. That could be because of their temperament. It could be a lot of things that then develop, that fear then develops into something more and develops into an anxiety.
Yeah.
But yes, fear can be taught. We can teach a child. The other thing is we can teach children how to cope with anxiety, right? So if we
Yeah.
cope with anxiety really well, or we're trying,
Yeah.
we're teaching them that.
Giving them a skill. Yeah.
We're giving them skills. So if they see you breathing, using your breath work, if they see you even using the calm corner, so the calming corner doesn't just have to be for your children, it can also be for you.
Yeah.
All of those things are great modeling. So we
Yeah.
model positive behavior, just like we can model negative behavior. So if something happens and we start screaming and we start yelling and we get dysregulated ourselves,
Mhm.
we're going to obviously teach our children to do the same thing.
Yeah. Yeah.
Or sometimes they want to do the opposite of what the parents did. So sometimes they become very, very repressed, right?
Yeah.
So I know some children that come to our unit, into our hospital, that are completely shut down with emotion. And when you look at it, their families maybe had so much emotion. They were
Wow.
so histrionic in a sense with their emotions that now the child is scared to show emotion because in their mind, if I show emotion, I'm going to be like that. And I don't want to be like that because that makes me feel bad.
Yeah.
So
Yeah.
again, we need to be very conscientious as a parent what we're teaching and modeling for our kids.
Mm-hmm.
And that doesn't mean that we we are the cause of anxiety, right? So there's just a balance there that we need to strike.
Yeah. 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 Okay, a couple of questions from our audience. And you talked about how ADHD and anxiety can sometimes be confused for one or the other. And so here's a couple questions along those lines. But
Sure.
one is this attendee says, my 11-year-old daughter was diagnosed with ADHD by the pediatrician. She's now in therapy as she has experienced some anxiety attacks. The therapist thinks that the ADHD was a misdiagnosis and that her symptoms are actually anxiety. So how can you know for sure? And what is the right specialist for the right diagnosis?
So there's only one way to know for sure, and that is a psychological evaluation. So a testing. Okay,
For
so and when
ADHD.
for ADHD,
Yeah.
then there's only one way to know for sure. A clinical interview by a professional is also a way that you can make a diagnosis, but it's not the most reliable way. The
Okay.
most reliable way is to have certain batteries of tests that are conducted on your child that will indicate differences, right? In these tests. And it's a complicated process. I'm not going to get into it right now, but
Right.
there are different tests that are going to aim to look for different symptoms and different processes that are going to show up for
Mhm.
ADHD that may not show up for anxiety and vice versa.
Gotcha. That's great. That's helpful. Okay, here's another one. Is it normal for the ADHD to not show in grades all the time? I think that maybe is a common misconception that if you struggle with, it doesn't have, you could be very intelligent and have great grades, correct? And still
Oh,
have
absolutely.
ADHD manifesting. Yeah. That's
Absolutely. You can, I mean, some of the brightest people have ADHD. Lots of physicians, doctors, psychologists, a lot of people have ADHD. It's a very, very common diagnosis. I think it's much more common now
yeah.
because, again, we know more and we're more equipped in making the diagnosis.
Mm-hmm.
Just like there's more anxiety now because there's less stigma and people are more open and willing to
Oh, yeah.
disclose their anxiety, just like I openly talk about my past with anxiety, right?
That's right.
I do that strategically because I want there to be less stigma
Yeah.
around anxiety and depression. But yes, you could be very bright. However, ADHD can become a barrier to academic success, which is why if you see that your child is struggling with paying attention, staying on task, organizing themselves, they're
Mm-hmm.
forgetful. These are all symptoms of ADHD. All of these things you should address it because of these symptoms, they may not succeed in school as well.
That's right. That executive functioning. That's, yeah.
The executive functioning may show up and get in the way of academic success.
Yeah, that's good. One viewer said, this is such a timely training. It is. And if you want more on ADHD, ADD, we actually have a whole episode about that. So you can look in the archives. And I think we should probably have another one. I would love to see an episode about parenting with ADHD because that's where I am. And I'm like, it's
Yeah,
a lot there.
yeah,
It's complicated.
yeah.
Okay, here's another viewer that says, the 16-year-old child feels that they check the boxes of being autistic, but gets straight A's, extremely competitive with themselves. However, has been told by pediatrician that they have anxiety. The child refuses talk therapy, has tried it for years. And then she said, second child, 13-year-old, just shared with me that when they read, they can't comprehend and they have to read over. So would you recommend, both of them for like a formal diagnosis?
Um, I mean, yes, right? Because I think it sounds like for the first child, it sounds like there's a lot of stress around diagnosis. If they're
Mhm.
checking the boxes and like self-diagnosing, to me, that always indicates that they really need to know what's wrong or what
Feeling, yeah.
feels weird and off. And so I always, recommend that they get a professional evaluation just to have answers because
Mhm.
answers may help reduce the anxiety.
Yeah.
And for the second child, if there are concerns, then absolutely as well.
Yeah. And that's interfering with their schooling, like you just said.
Yeah.
Okay, here's another one. Can you go over the 5 rule for anxiety?
Oh,
Well,
the five
you said it
senses.
quickly. Yeah, the five senses
Yeah, so
with
it's
older kids.
basically just when with older kids, you could actually just help them identify more senses, right? So instead of just doing what they see and what they hear for kids with the 3-3 and then moving their body, you can with the 5, you just do more senses. So 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can taste, and I'm forgetting the other one.
One you can smell, maybe?
And one that you can smell. Thank you.
Yeah.
Or you can do it in any
Yeah, any
order
order.
that you would like. And that can be very soothing for adolescents
Mhm.
and for adults, by the way. This is a
Yeah.
skill that we teach adults, we teach adolescents. We don't teach it to children because it's just too much,
Right.
right?
Yeah.
They can get a little overwhelmed and they're not as in tune with with all of their senses. But and by the way, you can teach it to some children. We're just the
Yeah.
3-3-3 is a little easier.
It's such a great activity too to just slow down, because it's like you
Slow
can do
down.
that easily, but you have to
Yes.
think about it and it's gonna slow
No.
you down.
And
You
Sierra,
gotta take it back.
that's absolutely right. That's the point of the exercise. It's a mindfulness technique, and the idea is to be more present and more aware of what you're feeling, and
Yeah.
it naturally slows you down.
Yeah. It's great.
Just
Are there
like breath work. Breath work slows you down as well.
I was going to ask, I'm sorry, I interrupted you, but are there any other mindfulness or relaxation techniques that you would suggest?
Yes. So I have here on my cheat sheet notes that progressive muscle relaxation is something you can teach even to young children, very young children. There's some scripts online that you can find for young children and some for teenagers. And you can help guide them. And basically what that is that you're helping the child tense the muscles and then release the tension of every part of the body. So you're going to tense your shoulders or your jaw and then release. You're going to tense your belly and then release it. You're going to tense your legs, and you can even break down the leg to the thighs, then the calves, your feet, your toes, and you go through the entire body with a script. And it while you take deep breaths, maybe in a comfortable position, and all of that can really help with anxiety as well.
That's great. That's
And
like
that's
the best
something
part of
I
the yoga
practice.
class, when they're
Yeah,
like, relax your neck. And you go, oh, I didn't even know I was tense there.
yeah,
That's
absolutely.
great.
Absolutely.
Awesome. Well, this is so good. I want to guard our time. We've got about 12, 13 minutes left. So we're going to fire around here on some of these questions. This is great. There's just so much good content here. Thank you, Anna. Okay. So we talked about anxiety around school. How does it manifest? You talked about, kind of have stomach ache, those things.
Mhm,
If there's anything you would add. But then what proactive steps can parents take before school begins? We talked about opening the door and having
mhm. Yep.
setting those calm corners in the home. Anything you would add there?
Yeah, so the other thing I would add, if there's a lot of anxiety about returning to school, you may want to provide exposure. So
That's
you may want to be prepared with a few things. You can drive them by the school more often. Maybe have an opportunity to go visit the school before they come back to the school. Maybe meet the teacher if
Be the
possible.
teacher day. That's great.
Yeah,
Yeah.
before coming back. And being prepared as a parent, if your child already has a diagnosis of anxiety and they're coming back to school, you may want to review their IEP plan, review their 504 plan, um, talk to the counselor in the school, have a plan set up for your child at school. Many counselors are happy to work with your child, they're happy to work with you. They just don't know sometimes.
Yeah.
Some
That's
parents are afraid to tell the school that their child suffers from anxiety. I would be mindful of the school setting. Of course, every situation is different, but I would encourage you, go speak, let your child know that you're going to, speak to their counselor and tell their teacher that they may struggle. And if it's part of the 504 plan, they
mhm.
can leave the classroom at whatever point they need to and go see their counselor
That's great. That's great.
in the
We
middle.
got a question from the audience on this
Yeah.
note, so I want to turn to this for a second. But this person asked, "What are some tips to speak with the new teachers about your child's behavior, say, namely anxiety, without predisposing, them to putting their child in a box?" I think that may be what could keep a
Yes.
parent from sharing. But what are appropriate requests for teacher accommodation for kids' behavior? That's the 504.
So, right. I think it's a myth that if you tell a teacher that your child struggles with anxiety, that they're going to be put in a box. I think Your
Thank you.
child will be put in a box by the teacher if you don't tell them, because what's going to
Mhm.
happen is that your child is going to act out in
That's good.
class maybe, or
Yep.
struggle in class in whatever way they struggle. And then the teacher is going to make their own assumptions about
Mhm.
what's the problem with the child. And
Mm.
depending on how psychologically minded the teacher is or not,
Yeah.
it could become more problematic than to being transparent and open with the
Good
teacher
word.
and
That's a good
saying,
one.
hey, my child struggles with some anxiety, worries. They're pretty sensitive. So just wanted to give you the heads up. If you notice X, Y, and Z, please let me know. Or maybe I've already spoken to the counselor. Maybe let her go speak to the counselor, because I hear nightmares from kids from schools where they're struggling and the teacher will say, nope, you can't leave the classroom.
Yeah.
And then they have a panic attack in the
Mm.
classroom because the teacher
Mm.
didn't let them
Didn't
leave
know.
to either even go to the bathroom to take a breath, which is some things we worked with kids on, some
Wow.
techniques that we give kids. If you're struggling, maybe go take a
Step
breather
out.
at the bathroom and come
Yeah.
back. But if the teacher's not aware, teacher will not let them leave the classroom.
That's good.
So
That's good.
you're more likely to cause problems if you don't disclose versus disclosing. And again, every situation is different. So
Great. That's
be
great. Oh, that's a good
use your
perspective. I
judgment.
hadn't thought of it that way. I thought of more of like, oh, if the parent's fearful to share, but
Yeah,
that's really good.
yeah.
Thank you for sharing that. Okay, how, if you may just want to add something, you've touched on this, but how would a good ways to encourage our children to open up about their feelings, anxieties, whether school related or not? Just how do we
Mm,
get them talking?
sure. I think I mentioned this, but sharing a little bit about your own anxieties, normalizing anxiety, right? Not
Yeah.
making it a big deal, not making them feel that there's something wrong with them if they feel anxiety, right? So that's what I mean by normalizing. Um, I think even watching Inside Out together,
Ah, that's
where
great.
it's very, they talk about anxiety a lot in the movie. That's one way to open conversation. Maybe reading together about anxiety will open conversation. There's great books out there that manage school anxiety and fears and social fears and things like that. So look for your resources in your libraries, in movies, and your own resource of yourself, right?
That's great.
Yeah.
Yeah. That's awesome. There's a podcast I love to listen to called Raising Boys and Girls. And I'm just putting a
Mm.
little plug. I'm not a professional, so don't, but they are, and you are. But just talking on this topic of how do we raise worry-free girls and worry-free boys,
Yeah, that's
because it's
great.
such I think you could speak more to the true numbers of this, but like, isn't it a crazy epidemic like never before? Just the mental health crisis among our children is
It's really hard. Yeah, and here in the inpatient side of things with suicide, which is a whole nother, I think we have another
we do have an episode.
webinar on
Yeah,
that, right? But
that's right.
it's second leading cause of death within adolescents right now and young adults. And so it's really scary. It's really a big thing. And so we need to target these symptoms of anxiety, because anxiety can become more, right?
Yeah.
Anxiety can be debilitating many times. It can interfere in their life and succeeding, right?
Yeah.
And then it can become bigger things. And so we want to target things early, early. Prevention, prevention, prevention.
Mention. That's good. Okay, let's talk about social anxiety because that's a very real thing for anyone at any age, especially for children trying to
Yes.
navigate a new school and making friends. Talk to us
Mhm.
about that.
Yeah, social anxiety is very common, particularly in the adolescent world. They are there's lots of more identity issues and self-esteem issues. And so they fear being liked. What if they don't like me? What if they, and by the way, these are very common anxieties.
Yeah.
It doesn't become a true social anxiety until you see avoidance,
Mm,
okay?
mhm.
Significant avoidance of
Okay.
social situations.
Okay.
But so
Good thing
again,
to watch for.
on a
Yeah.
continuum, there's normal adolescent social anxieties that are very common. And we want to validate them and we want to normalize them. And if we start seeing significant avoidance of social situations, not just school, but other social situations, then seek professional help.
Yeah. Here's a question on that note. And maybe I have a younger child, but I've noticed like theme days or it's like a dress up day, you know, and she just kind of wants to fly under the radar. Like, is that more, how do you know if it's not a personality thing versus a like, this gives me anxiety to like go all in with stuff like this?
I would ask,
Yeah.
I would ask if this is just, hey, is this just,
You're just not
something
feeling it. Yeah.
you're not feeling it, or does it make you kind of nervous? And
Yeah.
just ask about it. Again, the more conversations you have, the better, the more questions you ask, the better. You don't want to be that obnoxious therapy parent, however, right? We don't want to become that. But ask normal questions. You don't have to be the therapist. You don't have to use therapist voice. Just be
Right.
yourself. Because we get a lot of complaints about that from kids. My mom thinks she's a therapist, always asking me how I feel.
That's
So
hilarious.
don't become a therapist. However, just be yourself, be normal.
Yeah.
I don't even use therapist voice with kids. I
Yeah.
don't even act like a therapist with kids. I just
Yeah.
have
Just talk
conversation
to
with
them.
kids.
Yeah.
Yeah.
Great.
So do the same, do the same. I don't think, Sarah, like if it doesn't become a problem in other areas, we never want to take one isolated incident and pathologize it,
That's good.
right? Yeah, so we have to see that it's
Okay.
becoming an issue in multiple areas of the child's life.
Yeah.
One theme day, they don't want to go dressed up, they want to kind of hide. That's okay. That's
Yeah.
totally, that could be just her personality.
That's good. That's good.
Yeah.
All right, here's two questions wrapped in one. Our time is wrapping up, but I want to get
Yeah,
to
I see that.
everything. Okay, so what do we do if a child is refusing to go to school due to anxiety? And then at what point, and this is a question from a attendee as well, but at what point, should you be concerned or should your child be evaluated for a possible crisis?
Right. So I think again, if it becomes problematic for some time, then you want to address it.
Hmm.
School refusal once or twice is not anything to worry about too much.
Yeah,
But if it becomes a constant pattern,
like a battle
then
to go to
if
school.
it becomes problematic to go to school, or if it becomes a pattern for you, for your child, you should seek professional help
Yeah.
and evaluation. I think really, really important. I see a question, or is it
Let's see.
Madeline raising
Patty,
your
do you have
hand?
a
Or something?
question? Oh, might just been click.
Oh, it may have
Like,
just been, okay. Sorry.
she's waving,
So
saying, awesome, I agree.
yeah, so for school refusal, going back to exposure, kind of in the same way that we would prepare them to go to school if they have the jitters about going back to school, we can work with a therapist, or if it's not something very serious and you don't need psychological support yet, you can do it yourself, right? You can have a behavioral plan with your child, or with the counselor, with the help of the counselor, where you can slowly transition them back to school, right? So if they're refusing school and now you're going to send them back for a whole day with no progressive exposure back to school, that's going to be really tough, right?
Yeah.
So you may want to talk to the school counselor and have a plan together where maybe the first day back, they come into the counselor's office at the beginning of the day.
Yeah.
And then the counselor walks them to their classroom. Maybe you can have them go back to school for just an hour. I mean, for very severe cases of school refusal, school phobia, we do it very in short, very small increments of time. So we'll go to school with the parent, just go to the school, period.
Yeah.
Just
Yeah.
go, stay in the car and go to the
Yeah.
school. And then the next day we're getting off the car. The
Yeah.
next day we're having, but this is more for a more serious school phobia.
Right.
But if it's something just like here and there, and they're struggling with just coming back from that, then you may want to work just with the school counselor. If it's a
Yeah.
little more serious, then get some psychological support just to assist you with that exposure work.
Good. That's great. Okay, one question from our audience. This is, the son said, I don't want to be homeschooled, don't want to go to school, tells me he's feeling sad and empty inside, quote, empty. Never heard him articulate so clearly what's going on. He's such a bright student, made straight A's last year, a bunch of new friends, loved by his teachers. He does have a generally shy personality. At this time, should he need maybe a professional evaluation?
Yes,
Yeah.
yes, yes.
Yeah.
He is giving you all of the
All the
information you
ones.
need.
Yeah.
He's telling you that he's feeling
Yeah.
sad and empty. In other words, I need help.
Yeah. Yeah.
Rarely will kids tell you, I need help.
when
They
they can
usually act it
articulate.
out. Yeah, so you
Yeah,
don't want them to get to the point where they have to act it out. He's voicing it to you, listen and take him.
that's great. Yeah, listen, I love that. Thank you for speaking forthrightly about that. We never want to delay on things like that.
No.
Okay, one more quick one. Can ADHD go undetected and present later in middle school,
Yes,
perhaps?
yes.
Of course,
Some
yeah.
adults are diagnosed as adults because it went undetected for many years. Yep.
Yeah, case in point. Okay, last one. Wrap us up with tell us how, this is a lot of awesome information. I hope you all remember parentalguidance.org. Give us about a week and you can forward this on to a friend, a teacher, anything. But how can we help our children build resilience and coping skills that are going to benefit them for a lifetime?
So all of the skills that we've talked about today, however, there are so many more resources. I think you guys have a list of resources
We
that we
do.
provide that we provide you here as well. Um, just give them tools in their toolbox, lots of tools in their toolbox. The more tools they have to managing normal, typical stressors and normal life anxieties, the better they're going to be, the better they're going to cope with
Yeah.
time. So take advantage of those resources and then provide those to them in a developmentally appropriate way.
Yeah, that's great. Oh, Dr. Ojeda, thank you so much. And we do have a slide here, I think, with some websites, so you could screenshot that. I'm gonna have our team put it up here for you. Let's see, we may have it. If we don't have it, stay tuned. We will in the recording. There it is. Awesome.
There
So you
it
can
is.
screenshot these if you want to do another little kind of deep dive in some of the things that we've talked about. If you want to make an appointment with Dr. Ojeda, I know you can look her up there at Jackson and reach out in that way as well. Thank you so much for joining us. This is such an important topic. Again, in our archives, we do have some mental health episodes where we do a deeper dive into ADD, ADHD, those kind of things. And then we've got more webinars coming for you. So I'm super excited.